And in fact, 53 new COVID hospitalizations were reported in Rhode Island yesterday alone.
It brought the state's total hospitalizations now to over 300. It's the highest it's been now in 6 months. 12 News reporter Alexander Leslie joins us now. Alex, Target 12 obtained more information about which hospitals are now nearing capacity.
Well, the data shows that some intensive care units or ICUs in hospitals are full and others are just one bed away from being full. Governor Gina Raimondo saying this is the driving force behind putting the state on a 2-week pause. Now, according to Department of Health data obtained by Target 12, Rhode Island Hospital, the state's largest, currently has 24 clinical beds open with an ICU that's 89% full. The Merriam Hospital's ICU is at max capacity and there are a handful of clinical beds left there. Then at Kent Hospital, there's only one ICU bed open with 88% of its clinical beds full. Kent is overseen by Care New England. The hospital group's president and CEO says while beds continue to be filled, staffing has become an issue.
Our staff is starting to get exposed to household mates or others, so the effect on our being able to care for folks is causing some challenges. The stress is very high.
Now, while staffing challenges continue at the state's regular hospitals, hospital execs are also trying to figure out staffing at the state's field hospitals as well. I'll have more on that coming up in our next half hour. Live from Pawtucket, Alexandra Leslie, 12 News.
Right, as the number of cases continues to climb, data from the Rhode Island Department of Health is showing the state is dealing with the most hospitalizations since the month of May. Alexandra Leslie is joining us now to talk about field hospitals. They may start accepting patients next week.
Right. Target 12's Tim White spoke with the head of Rhode Island's second largest hospital group, Care New England. Dr. James Finale says that he expects the Cranston Field Hospital could start accepting patients as soon as next Monday to start alleviating the strain felt in regular hospitals. Now, 12 News got a look inside the field hospital at Sockanesset Crossroad earlier this month. A reminder, field hospitals will be used to transfer patients who are on the path to recovery but still need to be monitored. Dr. Finale says by opening these, he hopes to free up beds in main hospitals where more acute care is taking place. But he says the struggle is staffing these field hospitals, a problem people are dealing with around the country. Dr. Finale said he wanted to stress the field hospital will be safe.
We're not going to put people at risk into the field hospital. Okay, we'll make sure we transfer the right patients. We'll have it staffed to take care of those folks. But yes, we're coming up with different staffing models, and actually, although it's going to be stressful, we think we'll be able to staff it next week.
Now, the general manager of the Rhode Island Convention Center, where another field hospital is located, said he was told to start expecting patients there at the beginning of next month. Lifespan Group is tasked with running that field hospital. Live in Pawtucket, Alexandra Leslie, 12 News.